Good afternoon. I'm joined today by Dr. Liliana Arias Ureña, who the Alliance commissioned to carry out a research project called Disabled Children and Young People's Access to Support During COVID-19. And I'm delighted to have her here today so that she can take us through some of what the project entailed and also the research findings and some of the recommendations. Hi, Liliana. Thank you for joining us.
Hi, Francesca. Thank you very much for inviting me. It's a real pleasure to be here and talk about a bit more of this piece of research.
Yeah, well, first, we need to start by thanking you for carrying out such a great piece of work. So we're delighted that we were able to work with you. So to kick us off, can you say a few words about the project and why the Alliance asked you to carry out this work?
Yes, sure. Well, this was a piece of research commissioned by the Alliance. And the reason for doing this was that, as you may know, there is a lot of evidence showing that the pandemic affected people's health and well-being in very stringent ways. However, there is not enough knowledge, or there is not enough evidence of how the pandemic and lockdowns and mobility restrictions affected disabled people, or in general, disabled children and young people's access to healthcare and social care. So that was pretty much the reason for doing this piece of research. We wanted to listen to people, or young people and children, about how the pandemic affected their access to healthcare services, social care benefits, and support. So that's, in a nutshell, why we did this kind of thing. Yeah,
perfect. And tell us a bit about how did you do the research? So, as we would say, the methodological approach, but let's keep it simple. And how did you do the research?
Yeah, well, as I mentioned before, we wanted to hear directly from children and young people their views and their experiences. We didn't want to hear their parents' views or someone else's views. We wanted to be focused on their own views and their experiences. So for that reason, we opted for a qualitative approach with some participatory approaches as well. As you may know, children have rights, and a very important right is the right for participation. So we thought we needed to promote more these. So yeah, we wanted to hear from them directly, their opinions, their experiences. We feel like, regardless of their age, their medical conditions, their cognitive abilities, their communication skills, regardless of these kind of things, they can talk about topics in which they are experts, topics that matters to them. If we have the methods, if we have the methodology that reflect their needs and their preferences. So yeah, that was the kind of approach we had. Basically, it was a qualitative approach with some creative tools as well, and with a very important participatory approach as well.
And could you say a few words about the participants that you spoke to?
Yeah, sure. So as you may know, qualitative research is not looking for very big samples. Instead, in general, qualitative researchers are interested in knowing like the intricacies of people's experiences, opinions, and for that reason, we didn't want to have like a big sample. So we had a very small sample. We had 5 families from different regions in Scotland, and children were between 9 and 19. Well, children and young people were between 9 and 19 years old with different kind of medical conditions. Their family structures were also very different. They have different kind of routines and preferences, hobbies, and yeah. So in summary, we had a very small sample, but a very diverse in some way.
And so given that diversity of the sample and kind of the richness of the data that you collected, what are some of the key findings from the project?
Well, there are many findings. All of them are very important, but I would say that one very important was how the pandemic, how the healthcare services closures affected children's and young people's health in very bad ways, particularly in terms of having to deal with symptoms which were not under control, how not having appointments and treatments on time make progression of their conditions worse in some way. So yeah, it was, I think that was the main finding in relation to the healthcare section or the kind of healthcare component of the analysis of the data. I would say that that was a very important thing, because sometimes people tend to overlook that treatments are also important for people's everyday lives. I mean, because they need to be okay in order to have an everyday life. Okay, so if they had many symptoms that were not under control, and for that reason, they had limitations in their everyday life for that. That was one. Another very interesting was that when asking children and young people about their knowledge of the kind of benefits they had from the social care services, or the kind of social care system, they had a very limited understanding of this. So despite that, this was not initially a research question from the research. It was very interesting knowing that they don't know anything about the benefits they have access to. It was something I have to ask parents, basically. So that was another kind of important thing. Yeah, I would say that these were the two main findings.
As someone that's closer to the work, I know the answer to this, but I think it would be important to expand a bit on that. And I just wanted to ask a follow-up question on why that is. Why is it that children and young people don't have an understanding of the social care and benefits system?
Yeah, well, they said in general that information was but very complex to understand. I mean, they just said, I don't know, it's very complex. It's something I don't understand. So it's like my parents' business. I don't have to do with these kind of things. Yeah. That was one reason. But I partially understand that, because when you look at some of the websites where this information is available, the information is just makes available through text instead of having other kind of formats or like a more friendly language. So I would say that it also has to do with the way in which information is delivered on the websites and the kind of formats where the information is shared.
Yeah. So that's really interesting. And I think another thing that you identified through one of your participants was around the difficulty of transitioning from children to adult services. And I wonder if this finding has some implications for that as well, because if children and young people aren't used to understanding and navigating the social care and benefit systems, then of course, when they do the transition into adult services, it must be very difficult to navigate, I suppose.
Yeah, two of my participants turned 18 during the pandemic. And yeah, all the process of transition was very complex. And I think it might be nice to have like a better understanding of for children, it might be positive to have like a better understanding of the health, health no, because they have partially a very nice understanding of the healthcare system, but in relation to the social care system, because that might be very helpful in helping them navigate all this process. Actually, in some way, they were asking to be more involved in these kind of processes, because they were for the first time in some way, feeling that transition was a very important thing of their lives, and they would like to have like this kind of support from the from healthcare and from the social care system. So yeah, definitely.
Thank you. So yeah, to end on, I'd just like to ask you for a couple of key recommendations that you outlined in the report.
Yeah, well, these recommendations are pretty much based on children's and young people's recommendations, because as I mentioned before, they talk about the kind of things they would like to change about their experiences and how improve those aspects of their healthcare and social care services that were not working well. So they were asking to have or to keep the lines open in relation to communication with both systems, with the healthcare services and with the social care system, because they felt abandoned during the pandemic. They felt like they didn't have connection with people from the healthcare or system or the social care system. So they were asking to keep the lines open. That was one. Other one, they felt that they wanted to be listened to in some way. They felt that their concerns and their needs were not taken on board sometimes. So yeah, they ask for being listened more. They also felt that decisions in the future, particularly for in cases of emergencies such as the pandemic, it would have been nice to have like decisions more contextualized and yeah, like taking into account the particularities of their lives and their needs, because sometimes they feel like there were many blanket statements around their care and decisions. So they felt like it would have been nice to have like more contextualized, more individualized approaches instead of just having like standardized approaches to healthcare and these kind of decisions. Yeah, I would say that these are the main recommendations, well, in summary, because obviously there are many other, but in summary, I would highlight this.
Perfect. And any recommendations for further research around this to end on?
Yeah, I really feel like it's very important to explore more how children understand the social care system. I think that's a very interesting area for future research. Yeah, I think there is a lot of room to do or to explore in relation to this topic. For example, not only how they understand the social care system, but how much they know about their rights. I think that's important to explore that topic as well. Yeah, I would say that. Yeah.
Well, thank you so much, Liliana, for conducting this piece of work and for speaking to us today. And hopefully this is not the last time that you will collaborate with us, I hope.
Well, thank you very much, Francesca. And yeah, it's been a real pleasure to work with you. And yeah, thank you very much.